when we look at the idea of alternative payments, the goal is really to provide predictability and protection and mitigate risk. So a couple of ideas we'll talk about here: payment over time and other insurance type products, as well as expenditure caps. And so while these a lot of times are used for high cost disease states or targeted therapies, one of the things we'll touch on is you can actually use this really across the spectrum of pharmaceutical care. So going into payment over time and other insurance type products, I'd say we'd rank this list that you can see here probably in order from lowest to highest severity, but they all have risks and benefits associated with them. And so a mortgage, simply put, is a way to spread out the cost of a very high expensive medication, a very high cost or expensive medication that's administered one time, but to spread that cost out over a period of perhaps several years. Really helps from a budgeting perspective when you have $1 million patient, rather than having to incur that cost in year one or in quarter one. You can spread that out over time and actually be able to manage that over the course of a few years. The drawbacks are if the patient leaves the plan, you're still on the hook for that cost, even if the patient has left. It's an appropriate name too, because most of these drugs cost more than people's houses, at least mine. So transferring financial risk is another lever that's available. So when we think about getting a patient who has a disease state who may incur one of these costs, the ability to pay a PMPM prescription fee in order to transfer the management and payment for all services for that member would exist such that this member comes in there, they have this condition, we move them into this financial risk model, and so the plan would be absolved of having to pay for that treatment if it comes out. But on the flip side of that, you're paying a subscription fee, which for a disease or for a therapy that may never be used. And then reinsurance and stop loss, I'll kind of combine these together. I mean, essentially, what we're talking about here is this is guardrails, right? So if there's a base premium that's paid that's going to provide protection in the event that a significant, we'll say almost catastrophic financial cost is going to be incurred for one of these therapies. The difference is usually that with reinsurance, once it's used, it can be renewed, but usually is a much more significant cost. Stop loss is really that emergency button. And once you hit it, that's kind of it.